Doctors of Reddit, what is your worst case of I googled my symptoms? I had a grade school kid tell me he had a brain tumor. Turns out he put a dried bean in his ear and forgot about it. Edit. Okay, wow. Well, to answer a few questions, the kid was 9 or 10, so no stupider than your average 9 or 10-year-old. He didn't really have a reason why, but he'd been using beans for some counting thing in math at school. I don't know what kind of bean, it was small and red. It came out with tweezers. This was years ago, and he has probably forgotten all about it, unless his mom reminds him periodically. I would.
N.
Not a doctor, but I had a co-worker come into the office with this one. He was having nausea, fatigue, frequent urination and decided to WebMD that shoot. We're chatting in the office one day and he says something like, yeah, I've been feeling like shoot lately and it sounds like gestational diabetes, but I can't find any cases of men getting it. I just slowly lowered my head into my hand and asked him, do you even know what gestational means? He did not. Serious answer, I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says, I think I have caught the Down syndrome, or when a young woman thought she had testicular cancer. Paramedic student here. Last week we had a call for an imminent delivery. Part started having abdominal pain that would last a little bit and stop, and about 2 to 3 minutes later would start again. She googled her symptoms and everything she found was saying she was in labor. She called her husband and he told her to call 911. We walked in as the baby was crowning. She had no idea she was pregnant. Not a doctor, but when my fiance said he was having chest pains, and when he breathed, it crackled, I googled and all of the symptoms lead to serious illnesses such as collapsed lung. Thought nothing of it, diagnosed it ourselves as an allergy and didn't go to a doctor till later in the day. It was in fact a fully deflated collapsed lung. Not a doctor, but worked at a hospital for a while. One of our doctors came back to the nurses station laughing because someone was fully convinced they were diabetic because they were craving water and Webb said that makes them diabetic. Turns out they are just human and require it to live. Actually, I'm a doctor, but this story is from medical school. I had a patient who correctly diagnosed herself with mastitis, although she was very worried that she had inflammatory carcinoma of the breasts. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. I'm not a doctor, but I'm a medical assistant, and I room patients for the doctor. This is in the occupational health field, and we had a young gentleman come in who was pretty sure he had a groin hernia according to his Google search. He said he'd been lifting produce crates and experienced sharp, overwhelming pain in his groin. The doctor came back out after seeing him and was clearly fighting laughter by the time he got to the desk. Turns out the kid had chlamydia, which had caused things to become swollen and just happened to get symptomatic while he was at work. Had a patient come in and tell us she is having vision issues that are new. Okay, let's have a look. Oh, looks like you placed a contact over a contact 27 times. I had a friend who couldn't get her lenses out one morning after a night of heavy drinking, and she was trying to make me fish them out for her, but I recoiled every time I got close to them. After about 2 hours of this horrific panic, I called an eye doctor and arranged to bring her in. We were in a hotel, and when she went to pack up her stuff, she saw that she had taken them out the night before. She never even questioned that her sight was compromised. We aren't close anymore. This is one of the reasons. Not a doctor, but in 2013 I was feeling awful. Shaking, puking / dry heaving, shaking, excruciating, and debilitating pain. Went to the ER, had blood work done, that I never knew what it said, and the doctor told me it was a gallbladder attack, gave me pain meds, and sent me home. 3 days later I was even worse. Couldn't eat, couldn't sleep. The only relief I felt was when I was in scalding hot bath. I finally went back to the and they did more blood work and told me my gallbladder was septic and my pancreatic enzymes were 6500 and rising. They should have only been 100 to 150 and I was dying. I was admitted and when they did my gallbladder removal, my gallbladder was solid black and had 80 stones and a tar-like substance from sepsis. Come to find out the first time I went to the my enzymes were 2000. I should never have been allowed to leave the hospital. Not a doctor, but I deal with migraines. I would not be surprised if someone experienced a migraine for the first time, googled their symptoms while they still had the clarity to do so, and went to the thinking they are having a stroke. My brother is both the doctor and the patient in my story. Around 2 months ago he had started to feel really tired and ill, like really ill. He had said to his partner that he felt like he had leukemia, which was of course just kind of shrugged off, because why/how would he have leukemia? He had been suffering with a throat infection for a few weeks and was given antibiotics by a GP at his practice. After a week or so it hadn't helped, and he was tired and slightly breathless whilst walking the dog one Sunday afternoon. The next morning he registered himself as a patient and took his own bloods after being prompted by his receptionist, parents, doctor friend and sent them for testing. Unfortunately he had been completely correct, and when his results returned he saw that he did have leukemia, acute myeloid leukemia to be precise. He saw the results and knew immediately. As he went to confirm them with the GP next door, the specialist hospital had already called and asked for the patient to be brought into hospital immediately. Unfortunately his hemoglobin levels and general cell count were so low, and he was in a really bad way. Many transfusions and 1 round of chemotherapy down, and he is determined to beat this horrible disease. There's a long way to go, but he won't give up and neither will we. I love that guy so much and wish I could trade places with him. There's potential that I may be used as his bone marrow donor. I hope I can be, because anything I can do to help, I want to do. It's not too likely to be me, but I feel so helpless right now, so it would be good to help, I guess. Anyways, no Google, but turns out these doctor guys are pretty damn good at their jobs, even when it's certainly not their specialism. I had a UT because I had the symptoms and Googled it. Day of doctor appointment, it was just a regular checkup. But I asked for a UT test since I explained how I was feeling. Convo went like this: could it be possible to request a UT testing? I've been feeling the symptoms of burning when I pee and some discomfort. How do you feel now? Any pain? Well, no, not at the well. If you did have a UT the symptoms won't go away, you are fine too. Or so days later I get a full-blown kidney infection from a, who would have guessed, a UT. Sent out a complaint. Frick that beach doctor. I always ask for a test if I'm suspicious of anything, and I have them documented if they say no from now on. That was a horrible experience. Edit. I'm so sorry so many of you experienced similar stuff. But hey, glad we made it. Thanks for the upvotes. This confuses the frick out of me. When I go to a doctor they specifically ask if I've done research about whatever, like they expect it. Awkward position cause. If I have researched I feel like an idiot using Dr. Google and having medical student syndrome. If I haven't researched I get the distinct impression nice disappointed the document. Ever since we studied multiple sclerosis and neuro, I'm convinced I have it, despite my only symptom being paresthesis, funny feels in my legs at night. Not a doctor, but my friend once said a guy came with a backache and wanted to get operated cause he thought he had kidney failure. Not a doctor, but throughout my childhood and teen years I had these weird episodes where I would suddenly have really bad déjà vu and get very nauseous. For the next few hours afterward I would feel like I was in a fog and my memory would be shoot. Eventually I googled my symptoms and learned they might be minor epileptic seizures. I went to a doctor and he laughed it off and told me it was probably just having panic attacks related to the normal emotions of being a teenager. I was so sure he was wrong that I opted to go get an EEG. Turns out I have a mild form of epilepsy and Google was totally right. Not a doctor, but the brother of the patient. And worse, being on the money. My older sister diagnosed herself as having symptoms of systematic heart failure. Her new primary doctor agreed and gave her some basic guidelines of what to do and had her visit her cardiologist. The cardiologist poo-pooed her, saying there was probably nothing to worry about and scheduled a test in a few days just to be on the safe side. One of the things her primary had her looking out for was sudden weight gain, and when she woke up 2 days later suddenly 6 pounds heavier, we went straight to the emergency room, who ran tests, including an echocardiogram. Her injection fraction was 12, and they immediately sent her to the biggest hospital in the area, where they ended up saving her life from congestive heart failure. She had had at least 2 silent heart attacks due to the amount of damage they found. TLDR, I still have my sister, because she self-diagnosed correctly. Not a doctor, but I was having horrible debilitating headaches for a while. Googled my symptoms, and they ranged from stress to brain cancer. Ended up being sinusitis. Not a doctor. I had an insect bite basically next to my nipple. It was itching like crazy, and my usual bite cream said not to be used on nipples, so I decided to Google what else I could do to relieve it. Found out that apparently no one else has ever had an insect bite on their nipple, but that what looks like an insect bite on or right next to your nipple is almost certainly inflammatory breast cancer. Phoned up my GP, we used to be neighbors, so I kind of knew him and was in a right state because I thought I had this incredibly aggressive form of breast cancer. He listened to me for a minute, asked a couple of questions and then said, "It's an insect bite. Come back to me if it's still there in 3 weeks. Oh, and try deodorant on it." The deodorant calmed it right down, and it had gone by about 5 days afterwards. Not really related to this topic, but I'm a medical student and recently got sty in my eye. Sty is usually self-diagnosable, but I called up my cousin who is a doctor just to confirm. Anyways, when I was telling this incident to one of my friends, he started scolding me saying as a medical professional, I should set the example of going to the doctor and getting proper medicines and treatment, and all I could say was, dude, I'm becoming a doc. I know how doctors are doctors, especially when they know you're a medical student, tend to overdiagnose or pretend, as if we have medical student syndrome. But anyways, got the meds and my eye's healing. Daughter said she was worried about her medicine because she read on the bottle it causes Down syndrome. I told her you must have misread, and she cut me off because she was sure of it. Get home and read the bottle. May cause drowsiness. I had 2 separate doctors tell me that I was having panic attacks when in fact I was having simple partial seizures caused by a Lyme-sized cancerous tumor in my brain. I got so much Xanax though. The healthcare system where I live is broke. Someone I know didn't have a doctor, had been looking for one for 7 years, and started having worrisome symptoms. The urine clinics wouldn't order tests because follow-up appointments would be needed, and they didn't do that. She finally went to an and stood her ground, saying she wasn't leaving until they did tests. Google suggested she had a brain tumor or a hyperactive thyroid. They reluctantly did the tests, and she had to fight for the follow-up. Turns out it was a thyroid disorder, for which she was in bad need of treatment. Without Google, she didn't have much ammunition for the fight. I'm not a doctor, but I went to a doctor because I was certain I had delayed sleep phase disorder. He told me I couldn't have a sleeping disorder without being depressed, and made me take a depression test. It said I wasn't depressed, so he said obviously I don't have a sleeping disorder. I went to a sleep specialist a few months later, and they diagnosed me with delayed sleep phase disorder and helped me get it under control. At the hospital in my town there was a kid who came in saying he had knee pains. The doctor said it was from playing basketball, and 5 months later at a different hospital they found that he had knee cancer, and it was too late to treat him. He died a few weeks later. Really sad story. Obligatory backquote, not a doctor but the patient. Went to the docs several times as a teen complaining of being extremely lethargic. I slept like 13 hours a day, extremely pale, cold all the damn time, etc. All classic signs of anemia from what I had looked up. But the doctor said I was overreacting and just being a teenager, and refused to even check. Well, guess who ends up back at the doctor's like a year later after an emergency blood test showed my hemoglobin was at like 6. 2. Just being a teenager, my ass. Not a doctor, but once back in 4th grade, during winter break, I had some sort of illness that made me throw up, sleepy all the time, and a few other symptoms I can't remember. So I was at my mom's computer, and I decided to Google my symptoms, since my mom wasn't there. Turns out I had mono, or also referred to as the kissing disease. So after that, I was crying to my mom, hacking my guts out, while my mom tried to calm me down. And to this day, legend has it, I still don't know what I had, and I have never had it again. I'd say about 3/4 times a year I get a new, young, male that has googled their symptoms and determined they need a smear test. Yes, you read that right. A few men look for advice for their symptoms online and will end up on Mumsnet or the like and see women saying, get a smear test, without them actually knowing what it is. I always have to leave the room to excuse myself whilst I have a laugh. Obligatory, not a doctor. I was a patient. I googled my symptoms of hearing loss, tinnitus, vertigo, eye focus issues and headaches. I was fairly convinced I had an acoustic neuroma, a rare benign, but if not treated potentially life-threatening tumor on the 8th cranial nerve. The ent was convinced it was sinus related, but sent me for an MRI on the very slight chance there was something else going on. At this point I mentioned that I had read about the aforementioned tumor and she looked to be stifling an eye roll. It's always a brain tumor when we Google our symptoms, right? The morning after my MRI I received a call from the ent and she sounded shook. Not only did I have the tumor, it was as big as a golf ball and pushing against my brainstem. Took my 92-year-old grandma to her because it was Saturday. Told them I suspected UT. Doc didn't list. Finally she had to go potty and they brought a potty chair in. After she was through, the nurse went to empty it. She took one look at how her urine looked and went out and almost made the doc write order for test. Of course it came back as UT. It can be difficult to diagnose a dementia patient because they lose ability to tell doc what's going on. They also become afraid of doctors because they think they will put them in a nursing home or such. I googled my symptoms. I think I'm pregnant. You're a 58-year-old male. Paramedic here, and the worst instance I can think of was a young, fit woman who decided she was having a stroke after and openly admitting she had googling headache. A friend of mine, when I was younger, had been having chronic migraines. The doctors brushed it off, telling her to take some pain meds and you'll be fine. Keep in mind she was only in middle school. In the middle of class one day, she collapsed aneurysm. Ambulance rushed her to the hospital. Turns out she had a brain tumor the size of a peach. Had chemo, radiation, the works. Finally able to have it removed, so they cut a large part of her skull out to remove the tumor and had to wear a cast/helmet for months. 6 years later, she's fine now. Not a doctor, but I once thought I had appendicitis. Turned out I had an ovarian cyst that had burst. While it was extremely painful and I was in awful pain, it wasn't life-threatening and I was fine. A lot of the symptoms were very similar to appendicitis, and when I first arrived in R&D they thought I had it too, so I wasn't that much of an idiot, haha. I correctly diagnosed myself with dihydrotic eczema. The pictures I saw matched the issue I had. Then, I read that there are often chemical triggers. Then, I thought about all of the stuff I had done recently. Then, I remembered the lake in my backyard is full of chemical fertilizer runoff from the surrounding golf course, and I was in it about a week prior. Then, I did it again because I'm stupid. Then, I got a really bad case of the eczema. Then, I never touched the lake again. The end. If you know how to do a proper search on the internet and discern bullshit from truth, you can actually get pretty far. I helped my doctor diagnose my issues by providing him the information he'd found from people similarly experiencing my condition. Without my searching, the doctor would have just sent me home with antibiotics again. Not a doctor, but I'm currently in med school. When I was about 12 years old, I felt a painless lump inside my nipple. I thought this was something of low importance, so I continued to live my life. A few days later, when I was in the shower, I felt another painless lump inside my other nipple. I thought this was weird, so I decided to Google my symptoms. I thought about male breast cancer, and I knew it was a low chance of me having it, but I decided to look up some signs of the cancer. And there it was, in my exact words. Symptoms of breast cancer include a painless lump in the breast. I was terrified. I informed my parents, and I was in tears. I didn't know what my future would look like, and this thought shook me even more. Would I ever become a doctor? I then searched for treatments of breast cancer on Google, and it said the only treatment was to amputate the breast. I was even more torn. The next day my mom showed me an article about my breast cancer, and it turns out that I was just going through puberty, and this was completely normal. To this day, my family and I still laugh about the incident. Not a doctor, but work as a health advisor for NHS 111, and a teenager once phoned, probably like 13 over 14, because he had a bruise under his fingernail. He'd Googled it, and thinks it could be cancer. Turns out he'd knocked it a few hours earlier, but had just completely forgotten. Not a doctor, but this one is a doozy. A colleague of mine was feeling a bit under the weather, googled the symptoms, and determined he had contracted AIDS. He persisted in this belief for several days, up to and including telling his co-workers, and making out a last will and testament. After several days of hysterical bouts and self-pity, he went to the doctor to get medical treatment for his AIDS, and was diagnosed with a far less serious and very treatable severe case of the common cold. My stepfather was working in the garden one day and came inside complaining of feeling hot, tired, nauseous, and his legs hurt. We didn't Google his symptoms, but assumed he'd had too much sun. He went to bed and woke up several times and his symptoms were no better. My mum called an ambulance when he woke up at 1 AM vomiting uncontrollably. He was dead less than 5 hours later from septicemia. I think my doctor thinks him a bit of a drama queen for googling symptoms and coming in to get stuff checked now, but I'd rather err on the side of caution.